Hi, Dr. Cook here with Richland Spine and Disc, answering some questions that I commonly hear from patients regarding herniated discs, bulged disc, and degenerative disc, and the difference between those things. What I have here is a model of degeneration of the lumbar spine, which is the most common place to get herniated disc, although you can get them anywhere throughout the spine, including the neck, but low back is most common. These are low back vertebrae here. This is a normal vertebra, what it should look like, and these are what they look like as they start to degenerate and wear out. So as you can see from my spine here, we have vertebrae that make up the spine. In between the vertebrae are cartilage-like pads that separate the vertebra. The pads are made up of two parts. You have a gel center and an outer annulus. This outer annulus is made up of fibers that mesh together, kind of like a radial car tire or the strands of celery. If you've ever bitten into a celery stick, you can see those strands. And the outer ring is kind of like that. And in that structure, it allows our spine a full range of motion and flexibility. What happens with injury and with age is that disc can start to compress and wear down. As it does that, this outer ring starts to degenerate, and it can even get small cracks and tears in it. When it does that, it can no longer hold that gel center in the center, and what happens is it starts to push out. It can push out the front, the back, or the sides. Most common area for it to push out is out the side. Reason for that? That's the weakest part of the disc, due to two strong ligaments that hold the spine together in the front and back. Now that's kind of a double-edged sword, because what happens, as you can see with degeneration, is that the first thing you'll notice is that you lose height in the disc, right? So this nerve that exits here out of that foramen, which is just a fancy word for hole, allows that nerve plenty of room and space. But as that disc starts to lose height, it starts to put pressure on that nerve. And if you get disc tissue pushing out this way, you'll also put pressure on that nerve. When you put pressure on that nerve, it can cause pain locally in the low back. It can also cause symptoms down the leg, like sciatica, numbness, tingling, lack of muscle tone or muscle strength in the lower extremities, altered skin sensation. One side may feel more or less sensitive than the other. These are all things that we look at in the office on your first visit, along with your health history. If you have a question and believe that this may be something that you're dealing with currently, come into the office. We do a free first day consultation at no charge to you, and we can determine with a few tests if this is something that needs further imaging, such as x-rays and MRIs. Certainly if you've had MRIs or x-rays in the last few months or year or two, bring those in with you, and we'd be happy to give you our opinion.